Good day, fellow learners. Once again, this is your mentor, your fact check buddy, Ray Gapuz, joining you this time around for session number 40 for our next generation NCLEX RN pointers. And before we start, I'd like to invite you in this mission of ours. Our goal is to provide free NCLEX RN application and review to 100 nurses. We've done that and we're successful in the past 2 years. We've given scholarships to 100 nurses a year from Luzon, Visayas, and Mindanao. It's well distributed. And to help us achieve this, just watch and finish the ads in our videos. So thank you in advance for doing that. So let's begin. Without further ado, let's start with the first question. Of course, the first question that we need to ask ourselves when we're preparing for the next generation NCLEX RN is, what are the things that we need to study? And we can't do that decision on our own. We have to ask and obtain an expert opinion. When I say expert opinion, it has to be from someone who has seen it all. It means a mentor who could actually give you an overview of a concept that was based on the history of how these concepts are being asked in the actual test. And at the Gapuz system, you are sure, me being, I think, the only nurse in the world who has monitored NCLEX since the 90s. So I've been there, I've done that, and have taken the exam almost every time that they offer new sets of innovative items. Okay, so let's begin. And the first concept that we'll cover will be about adenovirus. Now, if you think about adenovirus, think about a range of illnesses such as the common cold, sore throat, conjunctivitis, acute bronchitis, pneumonia, gastrointestinal upsets or distress, and you need to focus on the type of isolation precautions that you need to implement. Now, for example, if I'm going to give you a key point related to adenovirus, the first thing that I'd like to highlight would be what type of isolation precautions would be appropriate if your client is exhibiting adenovirus conjunctivitis signs and symptoms. Like, for example, if the patient is having pink eye or reddish eye and inflammation, okay? So think about adenovirus conjunctivitis. In that case, think about two important things. You will need to implement contact isolation precautions and standard precautions. But what about if the patient is having adenovirus pneumonia, in which case you will need to implement standard precautions. Now, remember, the most significant and the most important thing, or the most important thing that you have to remember related to adenovirus would be the isolation precautions that you will need to implement. Okay? So before I move on any further, let me congratulate Sheena Ara Duaso from Arellano University, who passed the New Mexico Board of Nursing last January 12, 2024. And here's her success recipe. I passed the NCLEX with the Ray Gapuz review system. So Ray Gapuz review system has a total package when it comes to nursing review. My experience with them was awesome. Thank you very much for the kind words, Sheena. As I learned from the most basic comprehensive that serves as my foundation, YouTube videos, the books, NCLEX 311, pharmacology, nursing reminder sheets, TOP, that includes our QBank. They also have the one-of-a-kind Ray Gapuz review signature, the core shells. Thank you. The application that contains quick fix, Pecha Kucha, short quizzes, QBank, recommended facts, and analysis of NGN items, which is a must-have by every test taker. Now, you can avail of the core shells through our front desk staff, okay? I also get a chance to attend Sir Ray's mentoring and the 3 days quick fix program, which I think gave a huge points to my final exam. Part of these were answering unlimited questions from the QBank in the simulation room that lessened my anxiety because the setup is exactly the same as the actual NCLEX exam. Ray Gapuz review system has a very good set of mentors who shares their excellence to every student. The staff that I think were 24/7 awake just to make all the inquiries attended. Overall, they deserve a 10 out of 10 rating. Thank you very much, Sheena Duaso. My endless gratitude to you, Sir Ray and Tim, of course. Our pleasure to have assisted you. And now you have made the first step and the most important step to that great American dream of yours a reality. So now that you've passed the next generation NCLEX RN, all you have to do is relax a bit and wait for the universe to give you the signal when is the best time for you to travel to the US and practice there as a nurse. Just wait. Everything will come at the most appropriate time when you can best appreciate it. Okay? Congratulations again, Sheena Ara A. Duaso. Now, the next concept that I'd like to highlight would be cataracts. Now, remember, cataracts would be um, described as the opacity of the crystalline lens, and it could be due to accumulation of abnormal proteins in the lens. Now, how would you know that a client has cataract? Well, first, they will be complaining of blurred vision, and then the lens that are usually clear would appear milky or cloudy. But take note, the blurring of vision is usually painless. Sometimes they also complain of double vision or gradual loss of central vision, and including frequent changing of eyeglasses, as well as shifting or change in color perception and sensitivity to glare. Now, take note, if cataract is not properly managed, blindness can occur. But remember, the only treatment for cataract is surgery, and that would involve the extraction of the cataract. So, preoperatively, the patient will be given pupillary dilators or your mydriatics, such as phenylephrine or atropine sulfate. And take note, what is important for you to note, if I'm going to give you an advice, would be the interventions that you need to remember after cataract extraction. And that begins with the independent nursing intervention of positioning the client. Now, always remember to position the client on the unaffected side, or you need to put the patient on a semi-fowler position. Now, if after surgery, the client complains of flickering lights post-operatively, reassure the client that this is usually a normal or expected part of the healing process. Now, upon discharge of a client post-cataract extraction, what are the things that we need to instruct the client to be familiar with? First and foremost, we need to instruct the client that they have to wear the eye shield as directed. And it's also very important that they wear sunglasses when they're outdoors, and they need to avoid any activity that may potentially increase intraocular pressure, like bending, coughing, okay, straining during defecation, especially if they are constipated, heavy lifting, that's usually more than 15 pounds, and performing the Valsalva's maneuver. We also need to tell them to not to scratch the surgical site. Now, one of the most important instructions that we have to tell the client post-cataract extraction is they have to be oriented as to the common manifestations that indicate a potential development of a complication. Like, for example, if the patient complains of sudden severe eye pain, that indicates hemorrhage. If the client complains of visual floaters, then that indicates retinal detachment, which could be a complication. And then when the client complains of pain that comes with nausea and vomiting, that could be indicative of increased intraocular pressure. And then if discharges, either greenish or yellowish, are noted, that could mean there is an infection. Now, what specific modifications in terms of the client's environment need to be addressed? First and foremost, after cataract extraction, the patient becomes sensitive to glare. So instruct them to avoid bright lights, and they could initially, okay, use the indirect types of lights in the room. And of course, we also need to tell them to use artificial tears like cystine That's Systane. And use it 3 times a day or as directed by the ophthalmologist. Okay? So, before we proceed any further, I'd like to share with you our increasing number of passers from all over the world have come to the Ray Gapuz system and availed of our wide variety of instructional tools. Okay? Next, let's move on and let's talk about your gestational trophoblastic neoplasm. Now, in gestational trophoblastic neoplasms, usually there's an abnormal trophoblastic cells that grow after a molar pregnancy. Now, how would we know that the patient is having gestational trophoblastic neoplasm? First and foremost, pay particular attention to the group of signs and symptoms like the presence of bright red vaginal discharge, an enlarging uterus, severe nausea and vomiting due to an elevated human chorionic gonadotropin. And then pay particular attention to the fact that there's usually a passage of grape-like cyst from the vagina. And signs and symptoms of hyperthyroidism can occur because of elevated human chorionic gonadotropin. So, once again, focus on those signs and symptoms. Now, what are the things that we need to anticipate as a form of treatment for clients with gestational trophoblastic neoplasm? Of course, we need to prepare the patient for surgery, dilatation and curettage, and then chemotherapy or, if possible, hysterectomy. And focus also on identifying manifestations of complications related to surgery. For example, there could be infection. So note for the presence of fever and greenish or yellowish vaginal discharge. Note also for the potential of bleeding to occur after surgery. And of course, potential for uterine perforation. Now, the most important discharge instruction that you have to provide the client with gestational trophoblastic disease in order to prevent gestational trophoblastic neoplasm would be to avoid pregnancy for 6 to 12 months after the evacuation of your gestational trophoblastic growths. And so this would require the client to use contraceptives. So there should be strict follow-up as well as monitoring of the client's human chorionic gonadotropin levels. Okay, so the next question that we need to ask ourselves is, can we navigate through the NGN by just studying concepts? The big answer is a big no. Okay, so you have to learn how to navigate and answer questions using technology. Here at the Ray Gapuz system, we have our own technology enhanced learning tools. Okay, so we have our recommended books, and I asked one of our passers, most recent passers, which book helped you the most? And her answer is Ulcer. 3 times ko po binasa yung 311. So she read NCLEX 311 3 times. Yung pharma po, since yun ang weakness ko, so she also read the pharma book. Lahat po ng highlight nyo na meds habang matagal pa po at wala pa ATT, sinulat ko po. Lahat yon sa isang notebook, nakahelp po sa akin. Okay, so she wrote all the highlights that I gave them in one notebook, and then she says, nakahelp po sa akin mga bullets nyo. So she found the bullets that I've given her as very helpful from the boot camp to the quick fix. Okay, so thank you very much for sharing your success recipe. And this is actually a presentation of the contents of our course shell. It's a must-have for NGN test takers because the course shell, the quick fix course shells, covers all the topics on the test: safety and infection control, basic care and comfort, health promotion and maintenance, management of care, pharmacological and parenteral therapies, physiological adaptation 1, 2, and 3, and then reduction of risk potential, and of course, psychosocial integrity. So you name it, you have it. You have 8 activities per course shell, okay? So, and the last and final question is, what is the single most important ingredient to a successful NGN test? Well, a conducive environment that will give you a sense of focus, At the Ray Gapuz system, we have our own NGN simulation room and a comfortable classroom with limited class size. And I'm inviting you to avail of our next generation NCLEX RN Flex, the most flexible test prep class for the NCLEX RN. Your choice of live face-to-face class, live virtual class, on-demand unlimited video recorded lessons. Remember, you can do this either live or through our video recorded lessons. You have a Q bank and of course our 3 books, plus my strategies and quick fix sessions. The fee starts at 3,499. So once again, this is your mentor, your fact check buddy, Ray Gapuz, saying an NCLEX RN quick fix a day will turn away your NCLEX RN fears. So I'll see you on my next video.